Well, hello and welcome to another episode of EKU Online's eCast series. EKU Online's mission is to change lives by providing access to affordable and high-quality degree programs in meaningful disciplines that positively impact our society. We thank you for joining us today. Our guest is Associate Professor Dr. Rachael Hovermale from the School of Nursing. She earned her bachelor's from Ball State University, her master's from the University of Kentucky, and her DNP from Eastern Kentucky University. She has worked in mental health for 25 years and has been a psychiatric mental health nurse practitioner for the last 20. She has experience in both inpatient and outpatient settings, along with correction, integrated care, and college student health. Currently, she is practicing with several colleges, providing mental health consulting, psychiatric evaluations and follow-ups, as well as medication and lab management. She has worked at EKU since 2010 and coordinates the undergrad mental health course and has been the coordinator of the MSN program since 2016. Welcome, Dr. Hovermale. Let me begin by asking you a basic question, but one that's very important for our discussion, and that is for you to describe the Psychiatric Mental Health Nurse Practitioner Program. In other words, the PMHNP Program. Describe it for us, and if you could, tell us, where do graduates from the program end up working?
I'd be happy to. A PMHNP program here at EKU is 100% online. However, we really work to make sure that the students feel a major part of our program. So it is a master's prepared nurse with a primary focus in mental health. It is a family focus, so you can see, from birth to death is in the scope of practice of our program here. And our graduates can work in lots of areas. So they work in inpatient setting, outpatient setting, both private and community mental health. They work in our forensics. We've got several graduates that are in the prison systems. We have some that work in corrections in the county systems. We have some that are doing some integrated care in some of the schools. We have a lot of our graduates are starting to start private practices where they practice on their own. Integrated care is really starting to pick up, which makes me very happy. What integrated care is you have your primary care along with several other disciplines, maybe your OB/GYNs, your cardiac, along with your mental health. So it's kind of a one-stop where you can get all of your holistic care completed. So we're starting to see some of our graduates working those types of settings. Anywhere there's mental health, you can see a psych nurse practitioner can fit in.
This is a little confusing for a layman like myself. And does the PMHNP nurse take the place of a psychiatrist or the place of let's say a social worker who specializes in mental health? How does this position play into those kinds of roles?
Well, a psychiatric nurse practitioner, we do have some therapy background, especially here at EKU. We teach a lot of importance of therapy and being able to help people process. We don't really take the place of a psychiatrist. We kind of have our each roles now. We can kind of do similar things as a psychiatrist. We do psychiatric evaluations. We do medication management. We can do assessing for medical issues. Whereas a psychiatrist is a medical doctor first, so he has that general practice and then specializes in mental health. Whereas a psychiatric nurse practitioner has their bachelor's degree, gets their master's, and then focuses on mental health from the get-go.
Well, as you know, this program has consistently been ranked among U.S. News and World Report's top 50 best online graduate nursing programs in the country. And you have a 98% first attempt pass rate on national certification exams. Just very impressive. And just this year, you've won an International Blackboard Award. Please tell us what you think contributes to this outstanding success, and how do you maintain it? Because those are pretty high standards there.
It is a team effort. You know, we have fantastic practicing. All of our instructors and even our facilitators are practicing psychiatric nurse practitioners. So there's a wealth of knowledge and experience. We all have, luckily I have a major hand in helping who gets hired for EKU. So we ensure that each person that works for us has that dedication and high expectations along with that nurturing, learning experience for the students. We also have a fantastic relationship with eCampus, of course, and our instructional designers are very, very good at helping us to look for ways to engage the students. That's I think the best thing about our program is the students still feel like it's a brick and mortar feel. So we do lots of individual and synchronous Zooms with our students. So I think that's one of the ways that we maintain that high pass rate and the awards is because the program continues to improve each year.
With the International Award, that's a pretty big deal because you're talking about the entire world here. And for EKU to be recognized in that particular program is quite an achievement. How did you feel when you all received notification that you won the award?
Well, we felt extremely proud. It's nice, we realize that we have a top-notch program, but it's really nice for others to be able to see the quality of our products and the quality of our students in our team. So it was extremely humbling and exciting to be able to accept that award.
One of the courses you're teaching this term, Dr. Hovermale, is NSC 884, Rural PMHNP 3. Mm-hmm. And I looked at it, and it's really interesting. I hope you don't mind me looking at it, but
not at all.
Not only is it didactically challenging, but I see how you've built in these learning assets that seem to be fun, like the Jeopardy game is used as an exam review mechanism. Mm-hmm. In another one of your courses, you use a video branch scenario tool, routing students to different parts of the video depending on their answer to specific questions. Mm-hmm. Both of these are very creative pedagogical uses of software. How did you come up with these unique approaches to teaching, and how effective do you feel they really are?
Well, like I mentioned before, we have a fantastic team, always looking for ways to engage the student. That's one of the challenging of being online, is not having the student sit in front of us. So how do we engage them? So the faculty is very good at looking for ways, and our instructional designers have been fabulous of bringing things to us. And I think that's one of the strengths of our program is that we look for people's strengths, and our instructional designers are fantastic at saying, hey, I think this might be beneficial for you all to have this engagement. In fact, my branching was the first designer I worked with in the branching scenario she was my patient. So it's a good team. So
how effective do you feel they are? Do the students really respond well to these?
The students absolutely love any type of engagement that you can have. They love the Jeopardy. They love the branching. They always consistently ask for more. And so we're always looking for ways to improve it. We just did, with COVID, we've had some challenging because we've had to do some things a little not as perfect, as polished as they have been in the past. But we did for personality disorders. We did some videotaping so they could drag what personality disorder to the video that we've done. But the students absolutely love these types of engagement. They feel like they learn from them. I think it's, again, one of our strengths is looking for those ways to engage the student.
It's interesting because sometimes a criticism that comes down towards the instructional designers is, well, games aren't useful, games don't engage, and games aren't good. But everyone that I've talked to, every professor that I've ever spoken with that have used games in their courses for things like review of test content have found it to be not only engaging, but really helps with retention of the content for the students because they find it being fun.
Yes.
And I think there's a lot to be said about that.
Yes, I find them highly helpful. The
Yes.
Students, and they're kind of fun to create. Honestly, they're kind of fun on our end as well.
Well, I understand that the level of engagement you have with your students is exceptional, and as we just mentioned, the Jeopardy game and the branch scenario, for example. What other kinds of methods or tools do you use to keep students highly engaged in an online course? Because we all know that online can be a disaster if not done correctly. The student could get lost, the professor could go missing in action. There's a lot of things that could go potentially wrong. But your program seems to maintain this very high level of engagement, maintains an exceptional pass rate, retention rate, and again, winning awards of international caliber. So it's amazing that you have that level of engagement with an online course. So are there any other tools or methods that you try to use to keep your students engaged?
Absolutely. We do weekly Zooms, which is synchronous, and we have students in lots of different regions. So we have, I think currently we have someone from Alaska and someone from Hawaii, as well as Florida and the East Coast and West Coast. So we do these synchronous Zooms, and we try to vary the time a little bit to pull in some of those students that aren't in Eastern Standard Time. We also record them. We do a synchronous one-on-one in every clinical, at least one synchronous that the student has an opportunity to be with a professor and do a simulated interview. The students really like that. In fact, we've instituted in their final semester, they do an initial interview with a patient, a simulated patient, and then they come back and do a follow-up appointment on that simulated patient. And at that time, they get one-on-one with their facilitator with immediate feedback, which the students really like that. So we try to give, again, that brick and mortar feel. So we do lots of live things when all possible.
Do your students respond well to that?
They love it. It's consistently in our evaluations, the engagement, the Zooms, how much appreciated they are. So the students really like it. Even students I'll have put on, I wasn't able to attend any of the Zooms, but I really enjoyed watching them. They were very informative. So even the recordings.
Wow, wow, that's amazing. What do you like about teaching online? And how did you become so effective at it? Your reputation precedes you, I suppose, is the best way to put it. But you have a very good reputation for being an effective online instructor. What do you like about teaching online?
Well, it was a learning curve. I've always taught face-to-face lectures, and then I was pulled into the master's program about 6 to 7 years ago. So it was very much a learning curve, but I think that the effectiveness comes from those synchronous meetings, those live meetings that pulling the students in to get to know us and us to get to know them, and listening. If there's constructive feedback on their evaluations, can we do this better? Relying on the team, not just myself and my current. We pull in the facilitators, we pull in our instructional designer, we pull in eCampus, how can we make this more effective? What are you hearing? So I think it's continually looking to improve and accepting that the fluidity of online teaching, and sometimes you have to change. You can't be that brick and mortar feel. You have to have those engaging opportunities for the students.
Well, that leads me into the next question, which I'll be very curious what your answer is. And that is, what advice would you give to someone who's new to teaching online to help them become effective and engaging? Because a lot of professors, very good professors, struggle with that transition, and they find teaching online very difficult. So what advice or what tips could you give them to make them an effective and engaging professor online?
I think that the biggest tip that I tell my new faculty and facilitators is remember that you can't teach everything all at once. You know, and online you have to learn to be more succinct because you don't have that 3-hour window to lecture. So make sure that what you're teaching is clear and engaging and beneficial to a novice nurse practitioner. So I think that's, and to use the people around you, use your resources. You know, look to what opportunities there are. You know, when I first started, FNPs, the family nurse practitioners had some great ideas that I talked to them about. How did that work for you? And I've kind of built on those things. So I think that, you know, with the new instructors, to kind of try to make it your own. You know, look at the foundations and see, okay, what kind of twists do I want to use, and to use your team. We all have our strengths, and we're all cogs in that wheel. And if we can use each other's strengths, it comes out with a product that wins Blackboard awards and regional awards. So I think that's my suggestion is don't try to do it all at once. Use your team and be available.
Yeah, that reminds me, was it last year that you won a regional award in the southern part of the United States?
Yep, we have the UPSIA award for Southern Regional, and it was for engagement in students as well, you know, student engagement as well.
Very good, very good. Well, how would you compare, in your experience, how would you compare and contrast the traditional age college student with the adult learner that one finds typically in online programs? And not only compare and contrast, but do you do anything differently to engage those two populations?
I think that, you know, as far as learning, most of the online learners they're already nurses. They've already had a lot of life experience. They've got experience in nursing. So you can kind of increase, you know, the basic knowledge that you're teaching to the traditional, you know, your undergrad students. And you don't have to build the foundation anymore. Now you're doing the icing, you're doing the finishing touches. You can use a lot more scenarios that are real life and not have to explain them because the students have been in similar scenarios. They can relate to that a little bit better. So I think that the engagement's about the same. You know, they all want that interaction with you, but I think that your online students have a lot more life experience typically.
What would you say to a prospective student who, let's say, made an appointment with you and came up to you and asked you, Dr. Hovermale, why should I get a PMHNP degree from EKU? And why should I do it online? I don't like online. I'd rather do it face-to-face. Mm-hmm. Why should I get a degree?
Well, I have this question posed to me a lot. My undergrad students, you know, sometimes even before graduation, talk to me about the PMHNP program. I have them emailing me or, you know, instant messaging me and asking about the program. And you know, I'm a little biased, but I think we have the best program. I think as far as if you're looking for quality, if you're looking for competency, if you're looking for confidence in your own teaching, then that's why EKU is the choice for you. Online can be very daunting because a lot of times people see it as correspondence. So I reassure them that they will get to know their professors, that they will see our professors, and your core foundation of instructors, they will get to know very well. And that's one of the strengths of our school is that they feel like they know us and we know them.
What do you feel are the strengths of your student body that comes in to take these courses? Is it their past online experience? Is it the fact they have life experiences? Is it that they're just excited to be in school? What are some of the strengths of those students?
I think that anyone that's looking for an advanced degree has made the decision that I really want to learn. You know, I want to expand my knowledge. I want to expand my understanding of these diseases. So I think that they, unlike undergrad, you know, in mental health, sometimes you can have people like, oh, I don't need mental health. But when you're coming to an online master's in mental health, you have a passion for it. You have, you're like a sponge. You want to learn, you want to be aware. So I think that's the biggest thing. They have this life experience, and most people that come into mental health have some type of experience that's kind of drew them to mental health, whether it's they worked in the ICU and they see, you know, the depressions, anxieties related to their families and the patients, whether it's children's hospitals, you know, or whether they work in mental health, you know, they're drawn to that. They want to make a difference on a higher level. So their engagement and desire to learn is robust.
Do you still think with mental health, there's still that sense of being taboo to talk about it, or is it becoming less of an issue and more open to be able to be discussed?
Well, I think that changes on any given day. I think that there's still a lot of misconceptions on mental health. I think needs to be a lot of education on the brain as an organ, and sometimes organs need a little assistance. So I think that there, even in mental health professionals, you know, there's still a little taboo of I shouldn't suffer because I know all the things to do. And nurses are notorious for that, filling other people's cups and leaving theirs empty. So I think that there is still some stigma. It is getting a little bit better than it was when I first started. But we still have a ways to go when normalizing mental health in comparison to physical health.
Do you think programs such as the PMHNP here at EKU, with the quality students that you're getting and that you're producing with this degree, it seems to me that you're attacking the taboo part of that and the stigma associated with it, because you're having really good students help people in they really need help in. Would you agree with that?
Absolutely. Absolutely would agree with that. You know.
Yeah. I just see, I've heard nothing but good things about your program. I've never heard a criticism about it. I've just heard good things. And I'm just pleased because I have several friends who struggle with different mental health issues, depression or anxiety or some of these things. And some of them are still embarrassed to even bring it up, as though they're not supposed to have that. And I always wondered, you know, if I broke my arm, that would be one thing and everyone would feel bad for me and would try to help me find help. But something's broken in my mind, it's almost a stigma or a taboo thing. And I'm just pleased with your program coming out and with quality people addressing these kinds of issues, because I think it's very important.
Thank you. I think so too. You know, I think that the more people that see it as normal, you know, in the future, I would love to see, you know, you don't just get a physical every year, you get a mental health checkup every year. You just have, you know, go in to see your primary care doc, get the, you know, your physical done, and then you go to the next room and see the psychiatrist or psych nurse practitioner, and they check in on that. That's where I would like to see things going, is that each year you just have a mental health checkup.
Well, Dr. Hovermale, I would be remiss if I didn't talk a little bit about COVID-19 in the year 2020 and the effect that it's had on people on all different levels, all different fronts. And one of the ones that I would be real interested in hearing your opinion about is the mental health aspect of COVID, how it's impacting people, what they can do about it, how you cope with it. It's a difficult situation. Most of us have never seen anything like this before. And now we're housed in our homes almost exclusively. Some of us working from home almost exclusively. And we're losing interaction, losing engagement with people. And it's bound to take a toll on us mentally. So what are some of your thoughts about that?
Well, I've been doing lots and lots of talks on self-care and realization that, I'm seeing more people with having anxiety that didn't have anxiety. I'm seeing depression. Most people are very resilient as long as they see an end to the suffering or the end to whatever issues going on. However, with COVID, at this point, there is no end. All they're hearing are the numbers. They're hearing we're having increased in incidents. We're having, isolate, you need to stay 6 feet away from each other. You need to do these things. So people's anxiety levels are so high right now. And most people don't know what to do with those emotions. So it comes out in frustration and anger. So I think that we're seeing an increase in anger and agitation. Fuses are getting a little shorter. People working from home, there, when you have an office job, you go to work and it's a 9-to-5 job. You go home and your home is where you watch TV and spend time with family, with loved ones, with your children, whatever. Now where people are working from home, they're blurring those boundaries. They're blurring those work time versus home time. So they're working longer hours, sleeping less. So I think that, people need to take a break. They need to set their office hours. They need to still exercise. They need to eat right. And if they find themselves overwhelmed or feeling out of sorts, talking to someone, just because you have anxiety or depression, you can go and talk to someone and just voice those fears, those concerns. So I think that we need to practice more self-care, setting boundaries with ourselves and our work time, setting boundaries and making sure that we're getting our exercise. And people are social as a whole, making sure that you're staying connected with friends, with family, reaching out. I've even encouraged people to start writing letters again, just to have some type of engagement with their loved ones. I think that, at this point, not being afraid to talk about I'm afraid, or fear or concern, and to reach out. We're seeing an increase in lots of substance use and suicide and overdoses. And I think that some of that relates to the isolation that people are feeling. So that's why I encourage that reaching out, to not suffer alone, to whether it's a professional or whether it's a friend. And to just hang tight. You're not alone.
I think that makes a lot of sense. That makes perfect sense. Well, Dr. Hovermale, is there anything that you'd like to share with our audience that I didn't cover, or any last words of wisdom that you'd like to impart?
Wisdom, huh? I think that the biggest thing that I would encourage people to do is not be afraid to go after your dreams, and that mental health, even when I went through nursing school, a lot of people, mental health was for people that didn't want to do anything else, that couldn't do anything else. However, I think that we're starting to see that mental health is that foundation of nursing, and that we're starting to see people realize the importance of that brain as an organ, and how, like you said, that it needs to be addressed, to not be afraid to try new things, and learn a little bit more about PMHNP program. And I'm always available if you have questions, and thank you for having me.
Well, thank you so much for your time. We really appreciate it, and we wish you well in not just in your own personal goals, but in the goals of the PMHNP program. Look forward to more awards and more recognition, because we know we're in good hands with you guys.
Thanks, Steve.